When we look at our treatment methods, disc bulge is one of the conditions where we see the most results. No matter what stage the disc bulge is in, we can see good results. We know that there are 3 or 4 stages of disc bulge. First, there is disc bulge. The next stage is what we call disc protrusion and disc herniation. In all 3 stages, we have often seen patients who were bedridden or unable to walk recover and start walking again, achieving good results. I have been treating disc bulge for about 10 to 20 years now. The biggest problem we always face with disc bulge is that many people, due to lack of awareness or by going to unqualified practitioners, end up undergoing treatments like forceful manipulation, stepping and pressing on the area, or even procedures where they claim to puncture the disc bulge. It is when such treatments are done that the situation becomes most problematic. We know what a disc is, and we are also quite familiar with the spine, which contains many nerves that we often see depicted in yellow. Here, this area is what we refer to as the outer part. When we step on, press excessively, or poke with a sharp object here, problems can arise in these nerves, and we can see that the disc bulge becomes more problematic as a result. So what we always need to keep in mind is that the most important thing here is to never seek treatment from people who do not have a proper understanding of the anatomy involved. What is this? When we talk about a disc bulge, we can see it. The disc is something that lies like this washer. The reason for a disc bulge is the loss of water content in it. For example, if we take a green plant, when it is fresh and green, it can bend and twist easily. But once it dries up, it will be stiff and brittle like something that has dried out. You can see a similar condition if you look at an MRI. In the MRI, we call it a dehydrated disc because dehydration means the loss of water content. If we look at the MRI, we can clearly understand this. L4, L5, or L5, S1, or C6, C7. These are the most common areas where disc bulges occur. In all these places, dehydration or loss of water content happens. This alone is the disease. When this puts pressure on the nerves, it causes tingling, pain, or numbness in the legs or hands. So, what is the treatment for this? When we talk about treatment, the substance inside the lost discs or the lost water content is something like oil. The treatment is simply to provide that oil content. So what we have developed and understood over the past 10 or 20 years of treatment is that, according to the MRI, wherever the discs are affected, we specifically introduce a special oil at a particular temperature into those areas in a unique way. We gently apply the oil in a stream at a specific temperature directly onto the discs, treating only the exact spots where the disc is herniated, protruding, or bulging.